Hi, this is Steve Jane. I'm a MD PhD, fellow of American College of Cardiology, fellow of Society of Cardiovascular Imaging, Angiogram, and Intervention. I currently practice in Temecula and Murrieta as a general cardiologist and as an interventional cardiologist. I would recommend people to come to Temecula Hospital for cardiovascular service because it has the most comprehensive service in terms of cardiovascular disorders such as heart attacks, coronary disease, stroke. And in the past year or two, I personally calculated, I think Temecula Hospital saved at least over 1,000 patients' lives just by the STEMI program alone. STEMI is a myocardial infarction, ST-elevation myocardial infarction. It's a very dangerous type of heart attack. And just with this program, we have a team on call every day. With this program alone, we saved at least 1,000 patients since the beginning of the program when the hospital opened up in 2013. So yes, this hospital has the most comprehensive cardiovascular service, including coronary intervention, peripheral vascular intervention, stroke intervention, STEMI program, and structural heart disease program. So you cannot have a more comprehensive service than this in any hospital. So, and also we have become a teaching hospital. We have a not only residency program, but also fellowship, cardiology fellowship. And we also just started interventional cardiology fellowship. So it's a teaching program, teaching hospital as well. So we have the highest caliber, meet the criteria for fellowship. Cardiology is a very fascinating field. Heart is very complicated. It has a mechanical part, electrical part, and it is the most vital organ of the body. It was considered creation of the God and cannot be touched before Second World War. And since Second World War, there is a creation of a heart-lung machine, and there is a port, so circulatory support, so people can do open heart surgery. Ever since then, it has progressed to such a extent that we are actually doing a lot of treatment of the heart by open heart and also by minimally invasive catheter-based treatment. So, for example, coronary disease treatment first was treated by bypass surgery until 1992 when we started to have stent placement. And in 2003, FDA approved the first drug-eluting stent. So every 10 years, we seem to have a great progress, some breakthrough. Same with pacemaker. The first pacemaker was invented in 1956 period of time. And at that time, it was battery operated. It was outside the body. The first implantable pacemaker was 1958. It was so big, it was circular. It was implanted in the stomach area, and you have to change your battery every 3 years. But since then, many leaps and bounces have been made that the pacemaker is becoming smaller and the battery can last longer. And now we actually have leadless pacemaker. So the cardiology field, especially interventional cardiology field, has made great progress. Almost a major breakthrough every 10 years. So it's a very fascinating field. That's what I like about it. I always loved cardiology. Cardiovascular system has been very fascinating to me. I want to be a good cardiologist to help treat patient in this particular very intriguing field. A lot of times, I feel that it satisfies, and there's a constant learning and continuing medical education. I feel I can actually, it's stimulating and also exciting and challenging in the meantime. I feel it satisfies me when you were able to help patients in their, most difficult times, when they're sickest. So I think we get a gratification by treating the patient, make them better, healthier, and make them live longer. Especially when you come to the point that patient was having acute myocardial infarction, heart attack, especially ST elevation myocardial infarction, STEMI, which is the most dangerous type. We can see the difference. We can pull patient back from the precipice of death, pull them back, and then that will make a big difference in their life. I'm a man of multiple interests. I'm not 100% workaholic. I do like traveling. I do some exercise. I was a swimmer when I was a kid, so I still continue swimming, and that's my exercise. And I used to like karaoke quite a bit when I was younger. I used to love dancing, Latin dance, such as salsa, merengue, and bachata. I used to be in a performance team of a San Diego Island Touch bachata performance team for almost like 2 years. And I've been busy and have been doing that much, but that was my hobby. I think, yes, it's very important to live a healthy lifestyle. In terms of diet, Mediterranean diet is the only guideline recommended healthy diet. I think everybody should pay attention to what they eat and also be active and to exercise. And most importantly, control the cholesterol. If your cholesterol is not under control, and then you should eat healthy and do exercise. But healthy diet and exercise may not be sufficient to control the cholesterol good enough below the level of the guideline target. So I would recommend have low threshold to start statin. Statin medication should be taken for people with high cholesterol because it is very effective. And I always tell patients that if you want to take one medication to reduce the risk of stroke or reduce the risk of a heart attack, and you want to take one medication only, it's not aspirin, it's statin. High cholesterol is the number one risk factor for heart attack. According to the InterHeart study that they carried out in 18 countries, they looked at about 500,000 people with a heart attack. They looked at risk factors. The top 6 is number 1, cholesterol. Number 2, social stress. Number 3, smoking. Number 4, diabetes. Number 5, hypertension. Number 6, obesity. Number 7, 8, and 9 will be inactivity and poor diet. So number one risk factor for heart attack is high cholesterol. It's very important. That's my recommendation. I know there's a lot of misinformation on the internet against the use of a statin for controlling high cholesterol, and that was a big mistake. So it's very important to control cholesterol. Take medications, they're effective.